Welcome to Health Explained Clearly. This channel is dedicated to helping you understand health in a clear, practical, and science-based way. No fear-mongering, no exaggeration, just clear explanations to help you make better decisions for your health. In today's video, we're going to talk about the early warning signs of stroke that many people overlook, and more importantly, what to do in the first critical hours so you don't lose the chance to save a life. Many people believe that stroke happens suddenly, without any warning, but in reality, in most cases, the body has been sending signals long before the event occurs. The problem is not the absence of signs, but that we fail to recognize them, or choose to ignore them. Stroke is not a random accident, it is the result of long-term imbalances in the body, blood vessels, blood pressure, and metabolism. Before a major event happens, the body often enters a silent warning phase. Because it doesn't cause pain, many people assume everything is normal. Some warning signs may seem minor, but they carry serious meaning, such as brief episodes of dizziness, temporary numbness on one side of the body, slight slurred or slowed speech that resolves on its own, an unusual headache, different from before, temporary blurred or lost vision. Many people dismiss these symptoms, thinking, "I'm just tired," or "I didn't sleep well." But these short-lived signals should never be ignored. There are three common reasons. First, the symptoms often disappear on their own. Second, a busy lifestyle makes us delay seeking help. And third, we tend to judge our health based on how we feel, rather than actual risk. When unusual symptoms appear, the most important thing is not to panic, but also not to underestimate them. Stop and rest immediately. Avoid driving or doing dangerous activities. Take note of when the symptoms start and what exactly happens. When a stroke occurs, what matters most is not doing many things, but doing the right things quickly. FAST is a widely used method for recognizing stroke emergencies worldwide. 1. Face, ask the person to smile. If one side droops, it's a warning sign. 2. Arm, ask them to raise both arms. If one arm falls or feels weak, it's dangerous. 3. Speech, ask them to say a simple sentence. Slurred or unclear speech is abnormal. 4. Time, if any of these signs appear, treat it as an emergency. If you suspect a stroke, call emergency services immediately. Do not wait to see if it goes away. Lay the person on their side, with the head slightly elevated if conscious, to prevent choking. Loosen tight clothing and keep them warm. Most importantly, remember the exact time the first symptoms appeared. This information is critical for doctors. Never do the following. Do not scrape the skin or perform folk remedies. Do not prick the fingers to draw blood. Do not give blood pressure medication, heart medicine, or aspirin without medical instruction. Do not give food or drinks. These actions do not help, and may make the situation worse. In stroke medicine, there is a concept called the golden window. If a patient reaches a medical facility within about 4 to 4.5 hours, the chance of reducing brain damage and long-term disability is significantly higher. After this window, the risk of severe disability or death increases dramatically. Stroke rarely comes without warning. We simply notice it too late. Understanding small signs can make a huge difference between prevention and irreversible consequences. Stroke doesn't always arrive with severe pain. In many cases, it follows years of silent strain on the body. Understanding doesn't eliminate all risks, but it helps us recognize danger earlier, respond correctly, and avoid paying a lifelong price for a few minutes of negligence. If you care about health content, that focuses on understanding, without fear-mongering, or false reassurance. Consider subscribing to the channel, so you don't miss future videos. Understanding a little earlier can help us avoid a very high price later in life.